Hello, in this video we are going to discuss the atrial flutter. Now atrial flutter is a type of arrhythmia and it is characterized by a large or macro re-entry circuit usually within the right atrium. Here you see this is the right atrium and this is the left atrium. Within the right atrium this re-entry circuit appear due to some reason, and this re-entry circuit causes the atria to contract. Okay, so this ectopic beats appear within the right atrium, and this causes the atria to contract at a very rapid rate. So in atrial flutter, the atrial rate is approximately 300 beats per minute. So this atria contracts at a rate of 300 beats per minute approximately. Okay, now atrial flutter is associated with usually associated with the AB block. So during the AB block, the impulses from the atria are not reaching into the ventricles. Okay, so when the AB block is present in the AB node, the AB node is unable to transmit impulses from the atria into the ventricles. So if the AB block is 2:1, means that out of two atrial impulses or atrial contractions, one is transmitted and one is blocked here in the AB nodes. In AB node also the refractory period of the AB node is slow. So AB node transmit few impulses from the atria. So here two impulses of the atrial flutter will be after up to one will be transmitted into the ventricles. Okay, now if you look here, it is the P wave. Okay, this is the one P wave, this is the second. So after this P wave there is no QRS complex. So QRS complex is missing here, like it is not transfer into the ventricles. Okay, so it is actually blocked here. This is the second P wave and it is also blocked. Okay, and this is the third P wave. So after the third P wave, the QRS complex appear. So it is actually a 3:1 AB block. Okay, and the heart rate of the 2:1 block will be 150. If all the impulses from the atria are transmitted into the ventricles to the AV node, then the ventricular rate or the heart rate will be 300. If 2:1, okay, then it will be 150. If 3:1, it will be 100. If the AV block is 4:1, then it will be 75 beats per minute. Okay, now causes. The heart causes include the heart failure. It is the most common cause. Okay, and rheumatic heart diseases can also cause, and coronary artery disease can also cause atrial flutter. COPD or other hypoxic pulmonary diseases can cause the atrial flutter, and the atrial septal defect or ASD can also cause this. The causes and treatment of the atrial flutter is similar to that of the atrial fibrillation. Okay, so clinical features. The atrial flutter can be asymptomatic when the ventricular rate is slow, and when the ventricular rate is greater than 100, or it is normally around the 300 beats per minute. So there will be palpitations. Okay, shortness of breath can also occur. Chest discomfort can also occur. Dizziness and fainting can also occur when the atrial rate, when the ventricular rate is very high or the heart rate is very high. There is a cardiac, or there is a hemodynamic compromise. So the cardiac output will be low and there will be dizziness or fainting. Okay, now diagnosis. For the atrial flutter, the ECG, you will find a sawtooth appearance or a sawtooth baseline. Like here you see, this is like a sawtooth pattern. So this is the characteristic of the atrial flutter, and this sawtooth appearance shows the PVO, and PVO means that PVO shows the atrial contraction. So this sawtooth appearance, remember this for the atrial flutter. Okay, and this shows the PVO. The QRS complex of the atrial flutter appearing after every second or third tooth or PVO. Here you see it is appearing after every third PVO. Like this is one PVO, this is the second, this is the third, and after a third, the QRS complex is appearing. Okay, the sawtooth flutter waves are best seen in the leads 2, 3, and or ABF. These are actually the inferior leads. So lead 2 and lead to 3, you will find this sawtooth appearance. Okay, the tachycardia here is a regular, like the RR interval here is a regular. Okay, if you see, it is a regular, unlike the atrial fibrillation which is irregular. And the QRS complex here is the narrow. This is the narrow QRS complex, like it occupy 3 small squares. Okay, unlike the ventricular tachycardia which occupy greater than 3 small square, and it will be like a broad QRS. Okay, here narrow complex. Management. In atrial flutter, the heart rate is approximately, or the atrial rate is approximately 300 beats per minute. So we have to control the rate. Okay, so digoxin, beta blockers, or the calcium channel blocker like verapamil is used to control the ventricular rate. Okay, so for the rate control, remember these drugs. Now, to control the rhythm, DC or the direct current cardioversions is used. Okay, so it restore the sinus rhythm. Like here, the contraction is arising from the circuit in the right atrium, and normally the contraction arises from the SA node. So if you cardiovert the patient, all the cardiac myocytes will depolarize and the SA node will fire initially. Okay, so in this way we can restore the sinus rhythm. So for the rhythm, DC cardioversion is used. Okay, if the patient is hemodynamically unstable, then the best treatment is DC cardioversion. After the cardioversion, beta blockers or emidarones can be used to prevent recurrent episodes of atrial flutter. Okay, so antiarrhythmic drugs like emidarones or the beta blockers are the medical treatment for the rhythm control. Anticoagulation, like the atrial fibrillations, the atrial flutter also increases the risk of the blood clots. Like when there is a very high atrial rate, there the blood stasis occur in the atria. So when the blood stasis occur, it can increase the risk of blood clots or the thrombus, and there is also a risk of systemic embolus, and it can cause a stroke. So anticoagulation is necessary in patient of atrial flutter. Okay, so if a thrombus is present, anticoagulation should be started for at least 4 weeks before cardioversion. So cardioversion can increase the risk of thrombus or embolus if it is performed after the 48 hours of atrial fibrillations, okay, or the atrial flutter. So we have to anticoagulate the patient at least 4 weeks before cardioversion, and this anticoagulation should be maintained for at least 3 months following successful cardioversions. Okay, so warfarin is the important anticoagulants used in atrial flutter. Heparin is not used. Okay, other anticoagulants like the factor 8A inhibitors like rivaroxaban, epixabans. Okay, and the direct thrombin inhibitor like dabigatran can also be used. Catheter ablation. Now, if we break this circle, okay, or this circuit, we can manage or we can completely cure the atrial flutter. So for this, the catheter is inserted through the veins into the right atrium, and this area of myocyte or any area, okay, it is heated or freeze. Okay, so when it is heated, this area become fibrosed, and you know that a fibrotic tissue cannot conduct impulses. So in this way, through catheter ablations, we can break this circuit, and in this way we can completely cure like 90% of the atrial flutter. It is the treatment of choice for patients with persistent symptoms. So this was all about the atrial flutter. Thank you.